Wow, we are really diving deep with this one. Hyponatremia Treatment Standard 2024. This research review, it's dense. Get ready to unlock some serious knowledge about this, well, surprisingly common medical condition.
It really is more common than people think and way more dangerous than most people realize, too. This article does a really great job of breaking down all the nuances of the latest treatments.
Okay, so before we get into all the details, can we take a step back? Why is hyponatremia such a big deal in the first place? I mean, it's just low sodium, right?
Well, it cites the most frequent electrolyte disorder that doctors see in hospitals. And we're not just talking about, feeling a little faint. This can get serious. Increased risk of complications, longer hospital stays, even a higher risk of.
Okay, yeah, that got my attention.
It's fascinating, though. Hyponatremia isn't just about low sodium levels in a vacuum, right? It's a sign that your body's entire water balance is off. Like imagine a seesaw that's completely off kilter. That's what's happening inside when this occurs.
And just like a wonky seesaw, you had to figure out what's causing that imbalance to actually fix it.
Exactly. And this article, it excels at this. It outlines all the different types of hyponatremia, which is, that's really the key to figuring out the right treatment.
So it's not a one-size-fits-all situation.
Not at all. It's like, a mechanic wouldn't use the same fix for a flat tire and a dead battery, right? Doctors need different strategies depending on what's causing the low sodium in the first place.
Makes sense. All right, well, I am ready to explore these different types and, how doctors actually tackle each one. What's first up on our hyponatremia hit list?
Let's start with the most urgent scenario, severe hyponatremia. This is where things can go downhill really quickly and it can be quite dangerous.
All right, so let's set the scene. We've got a patient coming in with severe hyponatremia. I mean, their sodium levels are plummeting, things are looking serious. What's the emergency plan in a situation like this?
Speed, that's key. The article really emphasizes this, rapid intervention is crucial. When we're talking about severe hyponatremia, doctors often turn to what's called a 3% hypertonic saline solution.
Okay, hypertonic saline is like super concentrated salt, right? But how do they actually administer that?
So they've got a couple of options, right? They can use an IV bolus or they can do a continuous infusion. Think of the bolus like a quick hit of sodium, almost like an immediate boost, whereas a continuous infusion is more of a gradual controlled increase.
So two different approaches, but both aiming to get those sodium levels back up. Is one preferred over the other?
Well, and that's where the debate comes in. The article points out that while those bolus injections are super fast acting, there's also a higher risk of, accidentally overcorrecting the sodium levels, especially if you're not careful about factoring in the patient's weight. It's a delicate balance.
Overcorrection, yeah, that doesn't sound good. Like too much of a good thing can backfire.
Yeah.
What about the continuous infusion then? What makes that tricky?
Well, the thing with continuous infusion is it requires constant monitoring, right? You have to make sure those sodium levels are rising at just the right pace. So yeah, it can be a bit more demanding on the healthcare team.
Got it. So it's a trade-off then, right? Speed versus precision.
Exactly. And here's where it gets even more interesting. The article suggests that hypertonic saline might actually be beneficial even in cases of chronic hyponatremia, even before those super severe symptoms even appear.
Really? So like a preventative measure, getting ahead of the curve.
Yeah, exactly. Addressing severe chronic hyponatremia early on, before it becomes critical, can really help prevent complications down the line.
Right. An ounce of prevention is worth a pound of cure or something like that. You mentioned patient weight playing a role in treatment. Can you unpack that a bit more?
Oh, absolutely. This really highlights why personalized medicine is so crucial. The article specifically states that those fixed-dose boluses, they can actually lead to both over and under correction, solely based on a patient's weight.
So it's not just weight though, right? It's their medical history, their current condition, everything factors in.
100%. It's all about, seeing the whole picture, not just treating one symptom in isolation. Now, while that quick action is super important for severe cases, managing chronic hyponatremia, well, that requires a totally different approach.
Right, because it's less about that immediate, life or death intervention and more about long-term management. Yeah.
You got it. And that's why understanding the different subtypes of chronic hyponatremia is so important. The article breaks it down into three main categories: hypovolemic, euvolemic, and hypervolemic.
And those all have to do with the body's fluid volume, is that right?
You're catching on quick. Hypovolemic, that means low fluid volume, euvolemic means normal, and hypervolemic means high fluid volume. And each of those subtypes, well, it points to a completely different cause of hyponatremia, which means, of course, a different treatment.
Okay, this is starting to make a lot more sense. Should we break down each of those chronic hyponatremia subtypes one by one?
Let's do it. Let's start with hypovolemic hyponatremia, where the body's dealing with that low fluid volume.
Okay, hypovolemic hyponatremia. So we're talking about low fluid volume here. Sounds like the body is running on fumes. What's actually happening on like a physiological level in these cases?
Think of it this way. Your body is like, a pantry. In hypovolemic hypernatremia, not only are you low on fluids, but you're also losing those essential electrolytes, especially sodium. It's like someone raided your salt supply. This can happen for a bunch of reasons, like intense vomiting or really bad diarrhea, maybe even just sweating a ton.
So you're losing vital fluids and the electrolytes that, keep everything in balance. Makes sense?
Yeah.
What's the strategy then for replenishing those losses?
You hit the nail on the head. It's all about getting those fluids and those electrolytes back up to a normal level. A lot of times that means intravenous saline. It's the fastest way to directly deliver those missing elements.
Right, like a quick restock for the body. Although the article did mention that sometimes good old-fashioned oral rehydration can work, seems kind of low-tech, doesn't it?
Well, it really depends on how severe the situation is, right? In less serious cases, if the patient is stable, just sipping on fluids, like an oral rehydration solution, or even just salty foods and drinks, that can gradually get things back in order.
So even if it's not a five-alarm fire, monitoring is still really important with hypovolemic hyponatremia, right?
Absolutely. Overcorrection can be just as bad, if not worse, than the initial imbalance. So, yeah, careful monitoring is key. Now, on the other end of the spectrum, you've got hypervolemic hyponatremia, a whole different ballgame.
Hypervolemic hyponatremia. Okay, so now we're talking about 2 MECH fluid. The body's holding on tight.
Exactly. Now, that pantry we were talking about,
Yeah.
overflowing, but instead of food, it's fluid, right? This often happens in conjunction with other conditions like heart failure, liver failure, or even something like nephrotic syndrome.
So the root cause, the underlying condition, is what's driving that fluid overload, which then, of course, throws the sodium out of whack.
You got it. And that's why with hypervolemic hyponatremia, managing the root cause is like priority number one. But of course, you also got to address that fluid overload. That's where fluid restriction usually comes in, limiting intake to help the body kind of flush out the excess.
Right. Less and less overload. Makes sense.
Exactly. Although if that fluid overload is stemming from something like, oh, I don't know, overusing diuretics or maybe even internal bleeding, then obviously those causes have got to be addressed first and foremost.
Treat the source, not just the symptoms. Okay, but what happens when those lifestyle changes aren't enough? The article mentioned medications for this, right?
They did. There are several options, and they each target different things when it comes to fluid balance. So you've got loop diuretics. Those basically help your kidneys flush out extra fluid. And then there's tolvaptan, which is a type of drug called a vaptan, and that one specifically works on how your kidneys manage water. And then in severe cases, especially liver cases, albumin can be really effective.
Wow, that's a lot of options. Like doctors have a whole toolkit they can pull from.
Right. And we can't forget about urea, which has actually caused quite a bit of, debate in the medical community.
Urea? Oh, yeah, that's right. I remember that from the article. What's the deal with that? I mean, it sounds like plant fertilizer.
Well, it's true. Urea is naturally present in our bodies, and it helps with waste removal. But recent research has suggested it might actually be helpful in treating certain types of hyponatremia, too. Now, it's inexpensive, and it seems promising, but we do need more research to confirm its long-term safety and how well it actually works.
The never-ending quest for more data. I do like that this article, though, highlights the, established treatments and the areas where we need more research.
Definitely keeps things interesting. Ready to tackle the last and maybe the trickiest subtype of chronic hyponatremia.
Hit me with it. Let's do it. What are the ins and outs of euvolemic hyponatremia?
Okay, so this is where it gets kind of complex because with euvolemic hyponatremia, the fluid volume actually seems normal, but those sodium levels still stubbornly low.
It's like hiding in plain sight. Stealthy hyponatremia.
Pretty much. And a lot of times what's behind this sneaky imbalance is a condition called SIADH, which stands for Syndrome of Inappropriate Antidiuretic Hormone.
SIADH, right. It's like your body's internal hold on to all the water system goes a little haywire, even when it should be releasing it.
Exactly. And so, as you can imagine, treating the underlying cause of that SIADH, whether it's a weird medication side effect or another medical condition, that's critical. But even with that, there's some debate.
Oh, I'm listening. What's the controversy with SIADH?
Well, generally speaking, both American and European guidelines recommend fluid restriction as the, first line of treatment for euvolemic hyponatremia, specifically when it's caused by SIADH. Sounds logical, but some new research is suggesting it might not be as effective as we once thought.
Wow, so the go-to treatment might not be, the magic bullet. That's
Yeah.
really interesting.
Yeah, and it just goes to show that ongoing research and, being willing to question what we think we know is absolutely critical in medicine. But anyway, in those cases where fluid restriction isn't working or it's not an option, doctors have other strategies, many of which we've already touched on today.
Like those loop diuretics and the vaptans we were talking about earlier.
Yep, those can come in handy here too, although the research is still ongoing about the exact timing and when they're most appropriate. And you guessed it, urea is being looked at for this type of hyponatremia as well, just to add another layer of intrigue.
Man, it seems like the more we learn, the more complex this whole hyponatremia picture becomes.
Right. Oh, and speaking of complexity, there's one more exciting development I wanted to touch on before we wrap up.
Oh, I love a good cliffhanger. Lay it on me.
Remember those SGLT2 inhibitors we talked about?
Yeah.
The ones that can help manage both blood sugar and fluid balance.
How could I forget? They're like the, kill two birds with one stone of the medical world.
Exactly. Well, get this. Early research suggests that they might also be promising for treating hyponatremia, particularly in people with heart failure. Now, it's very early stages, but the initial findings are exciting, to say the least.
This has been an incredible deep dive. So much great info, but presented in a way that's clear, engaging, not overwhelming.
Yeah.
But before we go, what are the top takeaways you want listeners to walk away with?
I'd say, number one, hyponatremia is way more complex than a lot of people realize. Treatment is definitely not one size fits all, right? Understanding what type of hyponatremia we're talking about, hypovolemic, euvolemic, or hypervolemic, and uncovering that root cause, that's absolutely crucial.
So bottom line, talk to your doctor. Don't be afraid to ask questions. Explore your options. Be your own advocate.
100%. Knowledge is power, and this deep dive has hopefully given you the information you need to have those conversations. But of course, this is just the tip of the iceberg.
Exactly. This is the jumping off point. If something piqued your interest, don't be afraid to go down that rabbit hole. Read up on those SGLT2 inhibitor trials, do a deep dive into SIADH, or, just brush up on your electrolyte knowledge. Medicine is always evolving, and being an informed patient is empowering.
Couldn't agree more.
And on that note, we'll leave you with this. The article really focused on treatment, but what about prevention? What can you do in your day-to-day life to make sure your sodium and fluid balance is in a good place? Something to think about until next time.